Hello everyone, welcome to my YouTube channel, and in this video I will be performing a role play with one of my students, and after the completion of the role play I will discuss with them if they have made any mistake and what part of the role play needs some improvement from their side. So stay tuned with us, and I would like to request you, if you have not subscribed to my channel yet, please click that subscribe button. If you're watching it from Facebook, please like this video and share with others. Your support would be highly appreciated. Thank you. Okay, your 5 minutes time starts now.
Okay. Hello, good afternoon.
Good afternoon.
My name is Shazia. I'm one of the registered nurse in surgical ward unit. And I have been sent to you by your doctor to discuss about your discharge plan. Is that okay?
Yeah, nurse, you can discuss with me, but I don't want to be discharged so soon because I don't feel like that is good for me.
Okay, I can understand your worries, but don't worry about it. I will discuss all your regarding your concerns now. Before proceeding further, would you tell me your name, please?
Yeah, my name is Ali.
Okay, Mr. Ali, as I told you earlier, I have been sent by your doctor to you discuss about your discharge plan. So, can you tell me that what is the reason that you are reluctant to go your home?
Oh, nurse, I feel like I'm not independent at the moment, and I think if I do something at home, like if I try to shower or do any other activity, I will fall. So I'm worried about that.
Exactly, Mr. Exactly, your concerns are relatable. I can understand your situations and worries, but I will explain you regarding all of your concerns. Can you tell me that who is in your family? I mean, any family member or in your friend circle, anyone available to support you at your home?
Well, nurse, I live with my brother, and he works, so he cannot be always there for me, so that makes me worry.
Okay, don't worry. We will arrange some social worker who will available to support you if your family or friends are not available till you regain your fully independence. So somehow they will provide you support in absence of your family. So don't worry about it. We are responsible to arrange for you. Before proceeding further, I would like to ask about any other reasons that you are not willing to go home other than this sport from family or friend side.
Oh yeah, nurse, I'm not sure about the medication. How will I manage it? I don't know when to take them and how to take them. So that's also difficult for me.
I can understand your, worries. It is totally understandable, and if I can totally, understand. Regarding your concerns about medication, about your physiotherapy, like exercises, everything will be guided from hospital side before your discharge. Firstly, I will outline some some your concerns regarding physiotherapy and medication. First of all, here physiotherapist is available who will educate you regarding your mobility and will guide you some exercises in order to increase your mobility. So everything will be provided you before your leave to home. And the second thing which you told me about the medication, uh, pharmacist is available. He will instruct you how you will take your medication after getting your home. Is that okay for you?
Yeah, nurse, that's okay with me. And what about taking care of my wound? I cannot do that as well. So how will I manage that?
Yeah, exactly. Exactly. Your worries are totally, relatable. Here, community nurse are available in your community, so we can write a refer letter to her. She will provide assistance and to you at your home, at your doorstep, and she will take care of your wound and will redress, and everything she will do for you. And the further, you need to take appointment from your GP regarding any concerns you have about your wound, and if there is any other like any problem, you can call to them, or you can call to us. We are here available to help you any moment. Is that okay?
Yeah, nurse, you explained to me that really good, but would you tell me like how long it will take before I will be healed completely?
Yes, I can explain you regarding your concerns about how much time it will take. Actually, it depends upon person to person, because every person have different recovery, time. So in your case, it will take probably 4 to 6 weeks to get it healed, fully. So don't worry about it. I reassure you that everything will be okay. Don't need to be worried about about your medication, your exercises, and your about regarding your wound care. We are here to provide every kind of assistance from our side. Okay, is that okay?
Okay, okay, thank you, nurse.
Okay, and one more thing here, I would explain you that regarding your wound, if there is any excessive pain, if despite taking medication for pain, if pain is still persistent, you can call us anytime. And if you observe any bleeding from your wound site, or you feel you hot like feverish, you can contact to the hospital immediately for to seeking the medical advice. So we will respond you quickly regarding your concerns. Is that okay?
Yeah, that's right.
Okay, I hope I address all your concerns. If do you have any other problem and question, you can ask anytime. And I wish you for your speedy recovery. Thank you for your time.
Okay, thank you, nurse. Thank you so much.
Welcome.
Okay, you did it really good. I have just some suggestions for you. Your closing was good. I just want to give you some suggestions regarding your introduction and the sentences you used in the middle of the tasks, that they were really good, but I would like you to change it on some occasions. So would that be okay with you if I give you some suggestions?
Yes, yes, sure.
Okay, when you introduced yourself, try to ask my name right after your own introduction. You first told me about the discharge, and doctor has sent you for discharge, and after that you told me if you can know my name, or if I would like to tell you my name. So always say it at the beginning when you introduce yourself. Like, you can say, hello, good evening, my name is this, and I'm one of the registered nurses here at this ward. May I know your name, please? And if it is in a word, you can say, for confirmation purpose, may I know your name, please? So always ask it in the beginning. Okay. And
Okay.
the next one is active listening. When I was
Okay.
when I was telling you about my problem, like I'm worried and
Okay.
I don't want to be discharged. So you should, in the middle, you should say words like, okay, all right, but you are completely silent. So the OET assessor will not be able to see your video, so they don't know if you are listening to the patient actively. So in order to let them know, so you should use these words while the patient talk. You can say, okay, all right, mhm. So you can use these words, okay?
Okay.
And there were minor grammatical,
Okay.
there were some minor grammatical mistakes. One of them is you said who will available. Like, you did not say who will be available. You know, this is a grammatical mistake. When you say something in the future,
Yeah.
who will available, instead you should say who will be available. And when I asked you questions like
Okay.
about my worries, you said that you appreciate my concern and my concerns are relatable. These are really good sentences, but you should not use them over and over. You should try to change them. Like, at some occasion you could have said that, oh, that's a really good question, I really appreciate your question. So try to change them. At one task you can say, uh, i
Okay.
i totally
Okay.
I totally understand your worry, and let me assure you, let me reassure you. And in next task, if the patient again asks you a question, encourage the patient by saying, "Oh, that's a really good question." Okay. And at one occasion, you said, "Explain,
Oh,
explain you." So this is a grammatical mistake. You cannot, you cannot say like this. You instead you can say, "Explain to you." I would like to explain to you. Can you hear me? Okay, I think she lost her connection. So if you guys can hear this role play, the mistakes I pointed out, I believe she'll work on it and will get better. And apart from this, at one occasion, she said, "Don't need to worry. Don't need to be worried." So you can say you don't need to worry, and if you say you don't need to be, then you should say worried. You don't need to be worried. So instead she said you don't need to be worried. So you should always use third form of the verb with be. And on one occasion she repeated explain you. Instead she could have said explain to you, which is the correct sentence. And at one point she said contact to the hospital, which is again not right. Instead, she should say contact the hospital. If you have any other question, you can contact the hospital. And also about her closing, I would also like to suggest her that when you do closing, always do it in a proper way by saying, do you have any other question that you would like to ask me? If the patient says no, then you can say, thank you so much for your time. If you have any other query, you can just press the buzzer and I will be here to help you. Thank you so much for your time and I wish you a speedy recovery. By saying that you can press the buzzer, it is for admitted patients if the patient is in a hospital. If it is a clinic and the patient is not admitted, you can say, if you have any other query, here is my card. You can contact me whenever you want. And I wish you a speedy recovery. Thank you for your time. So this is how it is done. Okay, this is the end of this video. If you guys have not subscribed to my channel, please subscribe to it and support us. And I would like to help you guys to pass OET. And I would really appreciate your help and your support. Thank you so much.